My name is Rachel Conn, and I am a partner and chair of the California practice group here at Conn Maciel Carey. And I'm joined today with my colleague Andrea Chavez, who is a senior counsel and also in our Cal OSHA practice group. So, welcome to the 2025 Cal OSHA webinar series. And today we're going to kick it off with workplace safety after COVID-19, and what is on the horizon. We're gonna quickly take a look at what the COVID regulations were, what the orders were, and the guidance, and only in terms of kind of showing us where we started and now where we are, and what is the current law when it comes to COVID. But we're not even just talking about COVID anymore. We're talking about infectious diseases generally, with the rise of things like measles. We've been seeing some outbreaks of tuberculosis, avian flu, how to deal with infectious disease in the workplace generally. And we're also going to talk about some of the lessons that we learned from COVID-19, and that way how to prepare for infectious disease moving forward. And also we're going to talk about the infectious disease rulemaking. As you may know, Cal OSHA plans to rulemaking on an infectious disease standard for general industry. If you are in healthcare or healthcare adjacent, you know that you are subject to the Aerosol Transmissible Disease Standard, and there's some revisions on that as well. Our bio slides, I'll just give you a quick rundown for anybody who is not familiar with us. Again, I'm Rachel Conn. I'm in our San Francisco office, and while I do everything OSHA related, Cal OSHA is where I do most of my work, and in the West Coast states. And before joining Conn Maciel Carey, I was a partner and led the OSHA practice group at Nixon Peabody. And then, as I said, Andrea Chavez, who's a senior counsel, is also joining me today. And Andrea is in our Los Angeles office, and she does everything from Cal OSHA, labor and employment, and complex employment litigation. But she is my go-to person in Southern California for all of these things. And one of the things to talk about, or in terms of background, is although all of us did a lot of work with the COVID regulations and guidance and orders during COVID, Andrea and I spent lots of time litigating as well as working in compliance in the Aerosol Transmissible Disease Standard, which we'll talk a little bit about today. And even if you're not subject to the Aerosol Transmissible Disease Standard, one of the reasons that we're going to talk about it today is that potentially going to be a blueprint for what Cal OSHA does in infectious disease? So one of the things we're going to talk about is how that standard is structured. It's pretty much a beast of a standard. It's about 36 pages. We wouldn't anticipate something that big for general industry, but the structure of it allows it to be applicable to various infectious diseases, as opposed to just focusing on one disease or pathogen like COVID-19. So that is on the agenda for today. And one of the reasons why we are doing this as part of the Cal OSHA webinar series is that the standards that we're going to be talking about today are really specific to California. As many of you know, we have very unique standards here, our injury and illness prevention program, as well as, again, our infectious disease, our aerosol transmissible disease standard. So two very unique standards that are specific to California, which makes this a unique environment to see what is going to potentially happen with infectious disease. And one of the things that, even if you maybe don't have as many facilities here in California, or if you're a national employer, one of the things to remember is that what we see in California in terms of occupational safety and health tends to migrate across the country. So, one of the things to really keep in mind is although this will be whatever the infectious disease standard for general industry ends up looking like, it really has the potential to kind of be a blueprint for other states. So, keep that in mind as we go through this and think about not only how it may be applicable here, but how it may be applicable other places. And we're certainly seeing that right now with things like workplace violence prevention, where we saw that originally develop for general industry out here in California. And now we're seeing it pick up pace in other states. And they're kind of using Cal OSHA or the California statute as a blueprint for that. All right, so all of that by way of background, we'll jump into the COVID-19 regulations, orders, and guidance. And this is just a quick graph to remind everybody of the COVID-19 situation from 2020 to present. And one of the things that I think is, one of the themes of this presentation is one of the things that is very difficult about creating a regulation and a standard around infectious disease is that things like viruses change and evolve and develop. And as you can see on this slide, how deadly COVID was back in 2020, of course, changed dramatically by where we were in June of 2024, where this graph ends. And why is that? Because the virus changed and evolved. And that is not unusual for viruses. And when we talk about the Aerosol Transmissible Disease Standard a little bit more, in that they categorize diseases and pathogens based on the type of precautions that they require. And different strands of a virus can have different potential precautions. So things like, for example, monkeypox, which is listed in the Aerosol Transmissible Disease Standard as requiring airborne precautions, so things like N95s, that has changed significantly in the latest strand that we have seen, which is more based on, we're seeing infections more based on contact. So again, one of the things that makes this so difficult to regulate is that what may be proper precautions for a potential infectious disease or pathogen in one strand may not be the same several years later, and how to build flexibility in regulations that will allow for those types of changes. And when we take a look at the COVID-19 orders and regulations and guidance, you can see that evolution of what COVID was in the beginning and where it is now. You can see that in the different regulations that apply and the different guidance that applies. And we've really kind of come full circle on this. So early in the pandemic, when there wasn't any COVID specific regulations, of course, any potential hazard in the workplace in California is going to be subject to the Injury and Illness Prevention Program. So early in the pandemic, for those that were general industry or those that were not subject to the Aerosol Transmissible Disease Standard, were subject to the IIPP. So looking at the potential disease, evaluating the workplace, identifying hazards, correcting hazards, training on those types of things. So that's always a part of our IIPP. And in addition, including procedures for investigating occupational illnesses. That's all part of the IIPP. And in the beginning, that's what that COVID was regulated by. And for most of the time, that meant looking at the CDC and CDPH guidance and applying that, because that was a helpful tool in terms of identifying what the hazard was and corrective measures to take and how to investigate illnesses in the workplace. One of the big standards that kind of, I think, threw some people for a loop in COVID was respiratory protection. And particularly if, as an employer, you were not used to voluntary use respirators and things like that, remembering what those rules were, applying those in the workplace, and working with employees on respiratory protection, whether it was voluntary or required for the workplace. That was one of the top citations that we saw during COVID, was violations of the respiratory protection program, because it either, if you were an employer that did not, your employees weren't subject to the respiratory protection program pre-COVID, it may not have been something that you were particularly attuned to, and some compliance gaps we saw in terms of, again, things like Appendix D for voluntary use, and then in areas where respiratory protection was required, making sure that you had your medical clearances, people were fit tested, and making sure that that was documented. I can't tell you how many citations I saw during COVID for not documenting fit testing and not documenting medical evaluations and medical clearances. And one of the takeaways, I think, from the COVID pandemic was that a reminder that Cal OSHA loves documentation. And if there is no documentation, then to them, it didn't happen. And so making sure that we have things like, the requirements under respiratory protection all set up. And then, of course, the Aerosol Transmissible Disease Standard. This was kind of one that is, and we'll talk about this a little bit more in detail. And again, this is a very specific applicability, but one of the reasons that we want to talk about it today is that it may become a blueprint for infectious disease. And again, it's one where it covers various aerosol transmissible diseases, and not just a singular disease like we saw in the COVID regulations. So we'll certainly have to see a pivot to an infectious disease standard that is able to work through various diseases and pathogens and not just one. So something more similar to in the aerosol transmissible disease. And this is one that has been around for quite a while. And it was, what I would categorize as more of a sleepy standard, one we didn't see a lot of citations around, because in terms of, healthcare where it's applicable, we're talking about things like, TB and measles and diseases where we may have seen very few cases at one time, and they were much easier to manage, and we didn't see the issues come up that we did during COVID. And one of the things that we would want to highlight too as we talk through this is that when we see an infectious disease standard come out, one of the things that we're going to be looking for, and we hope employers look for, when they evaluate that draft, and in terms of the feedback that we give to Cal OSHA, is it something that is workable for outbreaks? We certainly, again, found that during COVID, things like the aerosol transmissible disease standard were very difficult to utilize during COVID, because they're just not flexible in terms of that level of outbreak. So something to think about when you're seeing that regulation come out, that draft. That is certainly something that we will be thinking about. So again, for workplaces that were not covered by the ATD standard, we saw various versions of the emergency temporary standard, and then we eventually saw the non-emergency standard. We saw a variety of different Cal OSHA guidance. And, one of the things that is a major takeaway from the pandemic, again, we'll talk about a little bit later, but one of the things to remember is that there was, at the beginning of COVID, this interplay between CDPH, the California Department of Public Health, and Cal OSHA Cal OSHA was putting out certain guidance, CDPH was putting out certain guidance, and it really took a while for those agencies to really start to gel and make sure that they were aligning and on the same page. So employers were looking at different types of guidance coming from different agencies. And so whenever we see a new standard, this potential infectious disease standard come out, it's one of the things that we really want to evaluate. Is there any flexibility for employers and for the interaction between CDPH and Cal OSHA? That gets to be really difficult because you can't include CDPH guidance in a regulation that isn't out or published yet, because that's not something that can be rule-maked on. So it makes it difficult in terms of flexibility around these standards. And then, of course, we had the state and local orders and guidance. So we were dealing with CDPH, and then you may have had local counties and cities. So this is just to highlight where we were, the complexity of it, and, in terms of kind of where we're going. Hopefully there's going to be some recognition of how complex this became during COVID. And when Cal OSHA develops the infectious disease regulation, accounting for hopefully streamlining this and making it much easier for employers to be able to operationalize. So now we're going to jump into what is the current COVID-19 guidance and regulations, what is applicable here in California currently to date. So now, like I said before, we've come through the entire evolution. This is going to look really similar to my last slide. We're back to the IIPP standard. So the Cal OSHA COVID-19 non-emergency standard has pretty much sunset, except for the record keeping, which we'll talk about in a minute. And we're back to evaluating the hazard under the IIPP, and then taking corrective measures, training, procedures to investigate occupational illnesses for potential hazards in our workplace. We still have the ATD standard, and we still have respiratory protection. So those are the three things from a regulatory standpoint that are still going to be in place. And of course, things like the standard as well on employee access to medical records, and whether any of the procedures that you have around COVID are going to be trigger that standard as well. So there are some, ancillary standards out there, but these are the three of them that when you are evaluating your policies and procedures, if you are not subject to ATD, you're going to be subject to the IIPP, and then potentially respiratory protection, depending on your usage of respirators or voluntary use of respirators, or the allowance of voluntary use of respirators in your workplace. So what is the current Cal OSHA guidance? Their guidance is that if an employer identifies COVID-19 as a workplace hazard at their place of employment, then the employer must identify, evaluate, correct any unsafe or unhealthy conditions. So again, what we just said, evaluating COVID for your workplace under the IIPP is going to be the regulation applicable for you right now and your compliance requirement. Also, the COVID Cal OSHA reporting and recording requirements are still up in terms of their guidance. So how, if you have a COVID illness in your workplace, when does it become potentially reportable and when does it become recordable? Of course, that's going to be less now that the disease itself has become less serious in nature. But that guidance is still out there, and it's still up. And Cal OSHA is going to expect to see employers still abide by it. And then, of course, we have our CDPH guidance on COVID as well. So quickly, just a review of where we are with the Cal OSHA non-emergency COVID standard. So the majority of the provisions under the standard sunset earlier this year. And that's also going to include all of the different sections. So outbreaks, employer housing and transportation. The sole provision left is the subsection on record keeping and reporting, which remains in effect for another year. And it requires tracking and maintaining records of all COVID cases, including the employee's name, contact information, occupation, where the employee worked, employee's last day at the workplace, and the date of the positive COVID test and or COVID-19 diagnosis. Retaining of COVID notices, although the requirement of those is no longer in effect. And then again, you have to retain the records for 2 years beyond the period in which the record is necessary to meet the requirements. And that the Cal OSHA guidance that is out reiterates the first piece of this that we just went through, that it requires the employer to keep a record and track those cases. And also a reminder that it also requires that information on COVID cases must be provided to local health department with jurisdiction over the workplace, CDPH, the division, and NIOSH upon request and when required by law. So that is the last piece of the COVID regulations that are still in effect. So, we talked about the IIPP a minute ago. Again, if you are not subject to the ATD standard, and by the way, if you are a lab that may handle ARID pathogens or diseases, you may have a situation where the ATD standard applies to one part of your workplace and then the IIPP standard applies to other parts of your workplace. So just keep that in mind, that we do have some mixed work places that may be subject to both. And there was, during COVID, a lot of discussion about, places like hospitals that may have administrative pieces of it that aren't subject to the ATD standard. And in those cases, either you put the whole facility under the ATD standard or you can break it out if you are, part of your facility is part of it or not. One of the questions, and we'll talk about, one of the questions is, how do we know if you're subject to the ATD standard? We'll talk about it in a couple slides here. But essentially, if you are hospitals, healthcare, some public health services, correctional facilities, things like that will be subject to it. I'm happy to talk offline as well, and to kind of get into the different nuances as to whether or not you're subject to the ATD standard. But generally, we're talking about healthcare and healthcare adjacent employers that have a high risk of exposure to those diseases. So even without a specific set of regulatory requirements, relating to the prevention of COVID or other infectious diseases, we're still maintaining a safe and healthful workplace under our IAPP. And of course, this doesn't just apply to COVID. It can apply to any infectious disease. So measles, tuberculosis, things like that have high risk to your employees in the workplace, that are highly communicable, based on things that are potentially aerosolized or droplet, easily communicable in the workplace. You should be evaluating all of those potential risks under the IIPP. And so aerosol transmissible disease standard, again, if you're subject to this, the IIPP will not apply to you, or it may only apply to your areas of your facility that are subject to it. But essentially, it protects workers from diseases transmitted via aerosols or droplets. So tuberculosis, COVID, measles, things like that. Applies to general acute care hospitals, emergency medical services, skilled nursing homes, facilities, correctional facilities, and other labs in some medical offices. And to the extent which employers are covered is also going to depend on the nature of the occupational exposure of their employees. And within this group, it's broken out into referring employers and to non-referring employers. And what that means is a non-referring employer is an employer that treats ATDs. And a referring employer would be somebody potentially like a skilled nursing facility that would transfer out individuals that had ATDs and would not be treating them in-house, but there would be certain rules that apply for the time period before they're referred out. So those are the different types of employers under the ATD standard. And the precautions that the employers have to take regarding the ATD is laid out in Appendix A that we'll talk about in a second. And one of the reasons why I want to talk about Appendix A is because this is something that we could potentially see in the infectious disease standard. A appendix that lays out all the different diseases and the different precautions that are required for each disease. So they lay it out by precaution and then the diseases that fall under that. Again, while it's helpful to list those diseases out and those precautions, diseases and pathogens change and evolve, and one strand may need a different type of precaution than another. So the key elements of the ATD standard, again, it's 40 pages long, but it's an exposure control plan, the different types of engineering and work controls that may be applicable. So things like isolation rooms and different types of ventilation, PPE, and including that respiratory protection, specialized training, medical surveillance, and also making certain medical services available. So making available certain types of vaccinations for employees that are subject to the ATD standard, and record keeping. And record keeping and documentation was a big one that we saw in COVID that was very difficult for employers to meet under the ATD standard, because it's a very it's a lot of documentation, and when you're having major outbreaks, it's almost impossible to work through that type of documentation. It also has a very detailed incident exposure analysis that you do in the event that you've had employees that you think may have had significant exposure to an ATD. So it's potential that you'll see something like that. And medical surveillance, one of the questions is, what is medical surveillance? So that typically is going to refer to if an employee has been exposed to a certain ATD, how we provide or offer medical services to that individual that potentially had a occupational exposure, and ensure that they're not creating other exposures in the workplace. And so I know that this is a little hard to read here, but this is Appendix A to the ATD standard. And essentially, and if you can't read it here, you should bring it up later today, take a look at it. And what essentially it does is that first, that second line in there says that diseases and pathogens requiring airborne isolation, infection isolation precautions, and then it lists out the diseases and pathogens that are subject to that. So that's going to be things like avian flu, measles, monkeypox, tuberculosis, and any other disease which public health guidelines recommend for that. But what is very unique here is that it includes new or unknown pathogens. So if there is a new or unknown pathogen, which COVID was at the time, it must be treated as new or novel. And then that means that it requires airborne isolation precautions. So that's the use of N95s in particular. So as you can see, anytime under this standard, there's something new or novel, it goes to the highest level of precautions. And when you have an outbreak situation, that can certainly be very difficult to work through, and particularly when we had in COVID, the N95 shortages. So, this is under the ATD standard, how the regulation manages to work for so many different diseases and pathogens. And so again, this may be something similar that we see in the draft infectious disease standard, a use of an appendix like this that will govern how the regulation is applied. So here is the current CDPH guidance for non-healthcare. Healthcare has different guidance and all facility letters. And if you recall, this was guidance that actually CDPH came out with early last year, even before the CDC did. So it's still in effect. It's what you should be looking at in terms of under the IIPP, and when you're evaluating the potential hazard of COVID in your workplace, it's appropriate to look at things like what's the current CDPH guidance around COVID or any other infectious disease that may affect your workplace. And what I think is interesting about this is that the current CDC guidance for non-healthcare, there's no COVID-19 specific guidance. Instead, it has respiratory virus guidance, and it covers COVID, the flu, RSV, and the guidance itself is very similar to CDPH's under COVID, but I think it's very interesting that the CDC has brought in the guidance to include other things than just COVID. And it's interesting in two ways. One, it now kind of puts COVID in the bucket of things like flu and RSV, which I think, early pandemic, that's not something that we would do. But also, is this a potential way that we may see Cal-OSHA structure a COVID-19 infectious disease regulation by maybe just looking at things like applying it very narrowly to respiratory viruses. Of course, that would potentially leave out other things like measles and tuberculosis that are not listed in this type of guidance, but some potential way that we may see that regulation structured. And then I'm going to quickly go through some lessons from COVID because I know we're going through some time here, but what were my biggest kind of takeaway from COVID is when we were dealing with conflicting guidance and conflicting regulations. And of course, what we learned is you're going to have to go with the most strict requirement, or you should go with the most strict requirement or order and guidance at the time. And remember, and this became an area of confusion during COVID, is that the Cal-OSHA regulations are legally enforceable. We're not always CDPH, their guidance, CDC guidance isn't legally enforceable unless it comes out as an order. So we certainly saw CDPH put out certain guidance that maybe didn't jive with the Cal-OSHA regulations, and employers followed CDPH and not Cal-OSHA and got Cal-OSHA citations. And just remember, of course, Cal-OSHA and the feds will potentially differ. What we saw a lot, again, also was Cal-OSHA's regulatory flexibility is limited. So as COVID changed or the public guidance changed, there wasn't that flexibility within the regulations always. And that created a lot of conflict and a lot of confusion for employers. And one interesting case that came out of COVID, and this is an ATD standard case, but I think, the reason why we bring it up is because it has a lot of, it shows how the Cal-OSHA Standards Board views the applicability of the regulations and how the regulation was applied. So if you remember, early COVID, N95s in high shortage. Here, the employer was rationing N95s for the highest levels of exposures. And so not every employee that may have had a potential exposure to COVID, they were able to provide it in N95, but they were rationing so the people with the highest exposures then had those N95s. And, this was basically an infeasibility argument, right? There wasn't enough N95s to provide to everybody. So it was almost like a hierarchy of how do we get things to the people with the highest exposures, things like that. Well, the board still found that there was a violation by the employer. However, they reclassified it from a serious to a general citation, saying that the employer rebutted the presumption that it was serious because it acted reasonably in the circumstances by taking all of the precautions that it did. But the takeaway is that despite acting reasonably due to the supply chain, Cal-OSHA still found a violation and the appeals board upheld that. And then, we've already kind of talked about some of these lessons from COVID. And just remember, again, also how the regulations interact with each other can be problematic, and you have to remember. So, and one of the ones that actually came up during COVID was heat illness. We had some employers move some work outside to help with ventilation, but then they didn't have a heat program. So remember, there's no exceptions to any of the other regulations just because you are in this pandemic. And with that, I'm going to turn it over to Andrea.
Thank you, Rachel. So now I'm going to cover, how to prepare for infectious diseases. While we've all been focused on COVID-19, I think for the last few years, it's important for workplaces to be proactive and prepare for infectious diseases beyond just COVID. Because I think the reality is infectious diseases are a growing concern that employers, need to address. So we can't forget about measles, tuberculosis, avian flu, and bloodborne pathogens like HPV and HIV, because these are all still very relevant threats. These diseases are not necessarily new or front of mind as COVID was, but again, they still present risks to your workplace. Okay, so measles is actually one that's been getting a lot of attention recently. So far this year, there have been 378 confirmed measles cases, and that's already more than the total number of cases we saw in 2024. And 90% of those are outbreak associated, which is also an increase from last year. And I think this shows, the herd immunity issue in the communities where these outbreaks are happening. So it's something definitely to stay up top of, especially if you work in an area with any of these outbreaks. Okay, so just to go quickly over, what measles is and how it spreads. Measles is an airborne illness, meaning it spreads when an infected person like breathes, talks, coughs, or sneezes. And it is one of the most contagious viruses in the world, which makes it extra important for us to be aware of it. The virus can linger in the air for up to 2 hours after an infected person leaves the space. So again, even if they're not there anymore, there's still a risk of exposure. And what makes measles dangerous, or even more dangerous, is that they can be infectious even before symptoms appear, especially during the 4 days prior to any rash developing. Measles is not a mild illness. It's very serious. It can lead to hospitalization, long-term illness, and even death. And symptoms usually show up 7 to 14 days after exposure. And they usually starts with like a high fever, cough, runny nose, watery eyes, and then a rash will appear in about 3 to 5 days. And this is all to say that if someone has measles or has been exposed to measles in your workplace, you really need to take action right away. Another thing to know, research shows that vaccines are key to preventing measles outbreaks. So avian flu or bird flu is another one we want to highlight. It primarily affects birds, cows, and other animals, but it can also infect humans as well. It's something we should be aware of, especially since the current strain, H5N1, has spread globally. So workers can become infected with bird flu in a few different ways. One common one is being splashed with liquids that contain the virus. They can also get it by inhaling tiny particles that are contaminated. Another way is by touching surfaces contaminated with the virus and then touching like their eyes or nose or mouth. This is just a reminder of how easily the virus can spread, where employees might be handling animals or animal products, or other environments where contamination can happen. Okay, so if your employees have exposure to bird flu, you're probably going to need a zoonotic ATD program, and that's under 5199.1. And it applies to operations that manage, capture, sample, transport, or dispose of wild birds or other wildlife. It applies to farms producing animals or animal products, slaughterhouses, veterinarian operations, zoos, things of that, workplaces of that nature. The zoonotic ATP is very robust. I'm not going to go over everything here, but it does require a program with detailed written safety procedures, exposure control measures, PPE requirements, and training. In addition, employers should have an effective IPP in place, and that's true for all employers. And then you must also ensure that employees have appropriate respiratory protection under Section 5144. And the respiratory selection should be based on the infectious disease hazard, so bird flu here, and on any hazardous substance that require the respiratory protection. Okay, so also don't forget about blood pathogens. The standard is under Section 5193 and applies to all occupational exposures to blood or other potentially infectious materials. And that's defined in the standard. The standard defines occupational exposure as reasonably anticipated skin, eye, mucous membrane, or parenteral contact with blood or other potential infectious materials that could, result from the performance of an employee's duties. And again, this is a pretty long standard. I'm not going to go over everything here, but the key requirements, as you see here, are an exposure control plan, a Sharps injury log, exposure determination, universal precautions, meaning you're trying to treat all blood as if it's infected, engineering and work control practices, PPE, hepatitis B vaccinations offered to employees at risk, and then post-exposure evaluation follow-ups if there's an incident, communication of hazards, and training and record keeping. So if you have any workers in the environments that are covered by the standard, it's important to be aware of, just what you need to do to address that issue. Okay, so in California, every employer has a legal obligation to provide and maintain a safe and healthy workplace for their employees. And the hazard assessment and exposure control measures are really at the heart of an effective IPP program. So generally speaking, you should conduct an infectious disease assessment as part of your IPP. When a hazard occurs in a workplace, CalOSHA typically infers from that hazard occurring that there was a breakdown in your hazard control system, which is again why these assessments are so important. The hazard assessment will give you really like a foundation to how to build your hazard control system for infectious diseases. An effective control system should do three things: identify hazards that currently exist or could develop in your workplace, outline how to correct those hazards, and provide steps you can take to prevent them from reoccurring. And it's important to encourage employees to report any potential hazardous situations to their supervisors. And when they do, the concern should be appropriately addressed. You should have a response protocol in place, and it should be based on the probability and severity of the concern or incident. For example, so when we're talking about, infectious diseases, we suggest having a different response protocol for isolated infectious disease cases versus, let's say, a widespread outbreak. So in terms of prevention, there are a variety of measures to put in place, including hygiene protocol, disinfection procedures, screening procedures, and PPE requirements. Employees should also receive training on, again, the safety protocols, recognizing hazards, proper PPE, how to, report concerns. And when you're reviewing the assessment and creating your infectious disease plan, it's important to keep in mind the need for flexibility, as Rachel mentioned, especially when we're going to be dealing with, various diseases, including emerging ones. You want a plan that can, adapt as new information, as new research comes out, and as new guidance becomes available. While you're developing your plan, review the guidance that's already out. Again, Rachel talked about this a lot, but like the ATD standard has a lot of good information in there that you can, pull some of it and use it in your plan. Also the sunset, COVID-19 regulations, and then any current updates from the CDC or CDPH. Okay, and here are just some key elements we think are important to have in a comprehensive, infectious disease policy. The policy should apply to illnesses, diseases, and medical conditions that pose a credible threat of transmission in your workplace. However, it doesn't apply necessarily to conditions like HIV, where, which is like generally not transmitted under typical working conditions. And when it comes to communicable diseases, it's important to remember that, each situation is unique, so they should be handled on a one-to-one basis. So every scenario will require a specific evaluation and response. Again, so flexibility is key. At the same time, it's crucial to review and follow guidance from federal, state, and local public health authorities, as well as, the CDC and other governmental agencies. And much of the guidance that's put out by like the CDC or other governmental agencies is very broad in applicability. So you want to incorporate those procedures, but at the same time revise them to if you have any specific needs or hazards at your workplace. Your infectious disease policy should include a clear reporting procedure. Employees should report when they are diagnosed with a communicable disease that could potentially spread in the workplace, or believe they have been exposed to such a disease, or have recently visited an area with an outbreak, feel unwell, or have other symptoms. And it's just essential again to establish, these clear reporting structures. And I think really saw that during the COVID pandemic. You also want to make sure that you review things like sick leave and other leave policies to make sure you're up to date on what's required there. Another thing just to think about is, what to do when employees travel. It's important to review travel advisories issued by agencies like the CDC and the State Department. They can help you determine the risk level of having that employee travel and, generally just guide your workplace policies. You should also consider things like if an employee has to travel and they become ill, what happens then? So we suggest that the employee, even if they're traveling, reports to the company their illness, and then they should be informed of any quarantine requirements, testing requirements, monitoring requirements that may be in place because they are now ill. And even if they don't get ill, if they've gone somewhere with a known outbreak, there should still be policies around, them monitoring their symptoms for any, issues, and then reporting if there's any concerns. If an employee is diagnosed with an illness, you may want to consider requiring medical clearance from a doctor before they return to the workplace. So that's just, having a fleshed out return to work policy. So when you're developing your infectious disease policy, don't forget to consider also the latest labor and employment laws. I know I already mentioned the sick leave policies to make sure those are up to date, but also just remember if someone is quarantined but still working from home, things like, wage and hour laws still apply. Okay, so where are we now with regards to Cal OSHA rulemaking? As many of you know, Cal OSHA is working on developing an infectious disease prevention regulation that will apply to general industry. And there's been no advisory committee or anything thus far. We have heard that there is a draft regulation ready, but it has not been released. And there's no, at least from what we know, there's no set time that it will be released. So we don't know exactly what it's going to look like. Will it be similar to the COVID specific regulations, or is it going to pull more from the ATD standard? Or is it going to be kind of like general guidance like the CDC? We just don't really have clear answers to any of those questions right now. And one of the biggest challenges in creating a regulation is that infectious disease knowledge and public guidance is constantly evolving. And this is something I know Rachel's already talked about a lot, but it's really tough to design a rule that is comprehensive and flexible enough to adapt to, to adapt as the diseases adapt. So we're definitely going to be keeping an eye on any updates and what they could mean for your place. Okay, so here are just some of the concerns with infectious disease standard for general industry. If the new standard ends up nearing an ATD standard, we could be looking at a kind of like one size fits all approach where every new or novel pathogen is treated as requiring the highest level of protection, even if science shows that that level of protection isn't like quite necessary. An important question is, when does a pathogen stop becoming new or novel? And how long does the employer have to require this maximum level of protection? A good example of this is for monkeypox, again, Rachel already mentioned, but it's been classified as requiring the strictest level of respiratory protection, even though the newer strain of monkeypox is actually primarily spread through direct contact and not air. And this is leading to inconsistencies between, the Cal OSHA requirements and then other public health guidance. An alternative approach would be for the new standard to be more targeted and focus on like specific types of infectious diseases. And this, may allow more flexibility, ensuring that the workplace protections align with scientific evidence and real world transmission risks rather than having a more rigid blanket rule. So again, but we don't know which approach Cal OSHA is planning on taking. Okay, then finally, I know we're running out of time, but Cal OSHA is also looking to update, or was looking to update, the ATD standard. We haven't heard anything about it since October 2021, when Cal OSHA released a draft of its revisions to the ATD standard. In that draft, it updated the Appendix A that we went over earlier to include COVID-19 and MERS as aerosol transmissible diseases. So that means they would no longer be considered novel diseases. It also incorporated guidance from the CDPH in the revisions and required COVID-19 vaccines where available to, it requires that COVID vaccines were available to healthcare workers. But again, we haven't seen any movement on this since 2021. So we'll keep you posted on what happens there. Okay, well, I want to thank you all for joining this webinar. I think we're out of time now. Here's just, the webinar series for Cal OSHA moving forward into the year. We have some good stuff on here, so we hope you join us again.
And just one quick thing, I just saw one question about whether or not the infectious disease policy is different than IIPP. We would recommend keeping those separate policies, but happy to talk about those another time. So thank you for joining us, and have a great day. Reach out if you have any additional questions. Thank you.